According to BeyondOCD.org, 1 in every 40 adults has OCD. But what is OCD? Obsessive-compulsive disorder is when people develop irrational fears or obsessions and believe the only way to prevent their fear from becoming a tragic reality is to perform certain actions or compulsions. It is an anxiety disorder and a disability. OCD is a disability because compulsions limit a person's major life activities. The U.S. Department of Labor's definition of disability follows the expert or professional model of disability because, coinciding with the Americans with Disabilities Act of 1990, employers take necessary steps to improve the position of the disabled person.
The longest period of time I spent wiping off the bad luck was close to 10 hours.
My OCD does stand in the way of the things that I want to do. I can't just go to bed at night.
It went from, a certain amount of times to actually ended up taking a really long time, constantly watering my hands, being trapped inside my own body, and I could never escape it 24 hours. It actually started to affect my relationships. It ended up affecting my job.
As you can see, OCD affects almost everything an individual does. It takes up an incredible amount of time in a person's day. Whether genetic or environmental, it is unclear what the underlying cause of OCD is. One piece of evidence researchers agree on is that OCD is linked to low levels of serotonin in the brain. Serotonin is the chemical responsible for behaviors such as mood, appetite, and sleep. Despite not knowing the exact cause of OCD, there are fortunately treatment options for the disability. Some believe therapy to be the best treatment option, in particular, exposure and response prevention therapy.
What happens with exposure therapy is the person is exposed to the thing they're afraid of. And this is done on a hierarchy. And then they work their way up that hierarchy by exposing the person to the feared situation or object until the anxiety begins to recede.
A pop culture source that shares this sentiment is VH1's The OCD Project, hosted by clinical psychologist Dr. David Tolan.
The most effective treatment we know of for OCD is called exposure and response prevention.
On the other hand, one prominent individual who is a proponent of treating OCD with medication is Dr. Naomi Feinberg. From her studies, she has found serotonin uptake medication is effective in 2/3 of cases. However, this 1/3 of patients who do not improve with medication, in addition to side effects such as nausea, dizziness, and headaches, may be reason enough for people to try therapy instead. Others still argue that medication is the best form of treatment for OCD because there is a scientific reason why it works. Because OCD is most likely caused by an abnormality in the way the brain absorbs serotonin, the most logical way to treat OCD is to fix the way the brain absorbs serotonin. Once serotonin is absorbed correctly, a person's irrational obsessions stop. Therefore, the person no longer has an urge to carry out compulsions. Although therapy may be helpful in explaining to people with OCD that their fears are irrational, medication gets to the root of the problem and destroys it, which is the ideal result.